Hello there, and thank you for your interest in this study. The title of this study is Probiotic Supplementation in Patients with Active Crohn's Disease. My name is Patrick Langley. I am a dietetic technician registered and a graduate student at the University of New England in the Applied Nutrition program and a master's candidate. This study and its researchers have no known or apparent conflicts of interest in completing the research and its associated protocols with the Institutional Review Board at University of New England or with the Experimental Biology Conference. This study takes into consideration the principles of the Belmont Report of justice, respect, and beneficence, and holds them to the highest of regards. In background regarding this study, what are probiotics? Probiotics are microbiota or bacteria that live within the host, and therefore they actually provide some benefit to the host. So it's more of a symbiosis that exists between bacteria and the human, and the bacteria are capable of doing things chemically and metabolically that humans are not able to do. Crohn's disease specifically is a disease of the gastrointestinal tract. It is related to inflammation that is caused by the immune system. The immune system actually increases its total amount of reaction to the gut based on many different factors. And it is a very complicated disease to manage. The Crohn's disease actually is a second portion of inflammatory bowel disease, which includes also ulcerative colitis. But this study will focus on Crohn's disease. Patients with Crohn's disease have the potential to have inflammation from the mouth to the anus throughout the entire tract. The inflammatory markers that this study will examine include C-reactive protein and erythrocyte sedimentation rate. The study design is a randomized, double-blind, placebo-controlled trial with 40 participants who are diagnosed with Crohn's disease, and that's participants who have a diagnosis of Crohn's disease and also have a Crohn's disease activity index within associated parameters. There will be a placebo group and an intervention group throughout this study. The objectives of the study are to increase the efficacy of using an H-strain probiotic, also referred to as VSL number 3, in improving inflammatory markers and associated inflammation in those diagnosed with Crohn's disease. The study also attempts to examine the best time period for improving inflammatory markers and whether longer time periods should be utilized through this intervention type. The literature review for this study examined different probiotic supplements in different forms and for different time periods to see which one provided the most efficacious of results. The most efficacious study is the one that used the VSL number 3 for 90 days or 365 days, and this time period that extended beyond 365 days was dependent on whether or not a participant had a relapse of Crohn's disease. Relapse was measured by Crohn's disease activity index, as is utilized to determine active Crohn's disease in participants of this study. The efficacious results of this study are intentional for replicating prior results in using the VSL number 3 and increasing the likelihood of desired outcomes in patients who are diagnosed with Crohn's disease. The inclusion and exclusion criteria are for patients who are between the ages of 30 and 70 years old, have a diagnosis of Crohn's disease, and by the measurement of the Crohn's disease activity index are considered within active. Active Crohn's disease, as measured by the activity index, is defined as 150 or 450. No greater than 450 and no less than 150 is considered active Crohn's disease. The use of identifiable information in this study will be managed primarily by the primary care physician of the participants and the willingness of the medical team to take on this responsibility. The medical team will work with the researchers and the participants in completing the necessary tests and providing them with the intervention and providing the necessary consent and assent as required. The utilization of blood draws is done so that participants can have their C-reactive protein and erythrocyte sedimentation rates measured as necessary before and after the intervention and 2 other times between the study for a period of every 30 days from start to finish. The informed consent will be provided by the primary care physician, and this will be before the intervention begins, and the participants must consent before beginning the study. Participants will be required to travel to the doctor 4 times throughout the study period, every 30 days for a total of 90 days. These participants will receive travel reimbursement for every time by the mileage driven on their car as required, and to increase the efficacy of participation in the study. The setting will be at Duke University Hospital and within their gastrointestinal unit. The probiotic intervention will be an H-strain probiotic supplement with 5 billion colony-forming units, and satchels will be provided prior to the starting of the intervention of 90-day supply, so it'll be 90 satchels of probiotics that they are to take once per day, and this will be instructed to them throughout the study and before the study begins. The statistical analysis of the study will be done based upon the changes in the inflammatory markers of erythrocyte sedimentation rate and C-reactive protein. This measurement will be done by paired t-test, and the means of all of the test periods from start to finish and the time period in between will receive a paired t-test to determine significance. Significance for the study will be within a 95% confidence interval, and the participants will have a p-value of less than 0.05 after evaluation and analysis of their inflammatory markers. The benefits and risks of the study. The benefits are improvements in Crohn's disease-associated symptoms, relapse prevention after the completion of the intervention, and their consideration potentially of furthering the intervention. There will be a decrease potentially in inflammation and an increase in quality of life. and it'll provide a potential alternative to expensive medications commonly used in the treatment of not only inflammatory bowel diseases, but also other autoimmune diseases that require autoimmune suppressive drugs. The knowledge to be gained in this study are to provide alternative interventions to those who have previously taken medications, or to add this intervention to the prescription of medications as an increase in efficacious treatment for those diagnosed with Crohn's disease. It is actually an economical option compared to some medications, and the study is intended to help increase evidence and support of using probiotic supplementation in those with active Crohn's disease. In conclusion, significant changes in erythrocyte sedimentation rate and C-reactive protein are expected, and if this is to occur, it will be done so with a p-value of less than 0.05 and a confidence interval at 95%. This significant change in inflammatory markers will assist in providing more evidence for using probiotics in those with active Crohn's disease. Thank you so much for the interest in this study. These are my references. Thank you.